Hi, I'm Effie Siomos. I'm an OBGYN doctor at Women's Care of Wisconsin. I've been there for 3 years and I practice primarily in Berlin, but there are lots of women's care sites in the Neenah, Appleton, and outlying areas. What made me decide to go into women's health, and more specifically OBGYN, was delivering babies. They kind of catch you with that early, right? It's medical school, it's 2 in the morning, you're half asleep. Like, what other thing can be more exciting than like being there for new life in the world? But it's a really amazing time to be involved in somebody's life. In Berlin, where I practice, it's a more rural area, so a lot of times people come in for a lot of different reasons. So I do pregnancy care, I do more high-risk pregnancy care, and then there's birth control care, miscarriage care, hysterectomy care, and sometimes even cancer care that we're involved in as OBGYN. So there's a huge gamut of things that sometimes people don't think about necessarily with their OBGYN, but it's a great field with so much variety, and you get to meet a lot of different people, do a lot of different things. When people come to women's care, I specifically want people to feel like they got something out of that visit. For some people, they might truly be looking for a change, like a change in their life, whether it's their health, their overall well-being, maybe it's a particular pain, maybe it's weight loss, maybe it's sleep, maybe it's emotional struggles or family struggles. I really want people to feel like they got something out of that visit on that day, and that they walk away with a plan, right? It's not just like you walk in and 15 minutes later we forget about you. Like, no, what is it that you came in for? What can we help you with? And how can that make your life better? And that's what I want people to come away with. The circle of care is really connecting all the people that are involved with patients when they walk into the clinic door. So it's not just the doctor you see, it's a nurse that's involved, it's the medical assistant, it's the front desk person who greets you and is polite. And then it's also all the connecting folks too, in terms of nurse practitioners or physical therapists or the person that draws your lab work. All of these people, in one way or another, touch patient care when patients walk in the door. And all of that kind of comes together to make sure that you get the best experience and you get your needs taken care of. Because at the end of the day, we want you to be in a better spot than when you started here.